Guide to Cleft Bottle Feeding. A baby born with cleft lip and palate or cleft palate only has a gap in the roof of the mouth, between the nose and the mouth. This prevents the baby from generating enough negative pressure or suction in the mouth to draw milk from the teat efficiently, even if they have normal sucking and swallowing reflexes. Babies who struggle to feed get tired easily and take in fewer calories. These calories are then used up for feeding rather than for growth. Specially designed bottles and teats can help your baby overcome this problem, making feeding easier. Nurses and speech therapists from our Cleft Center will help you choose a suitable bottle for your baby. Babies with cleft palate usually find it hard to latch on for breastfeeding. Expressed breast milk or infant formula should be fed through a cleft bottle for optimum nutrition. During feeding, some milk may flow out from the nose. This is called nasal regurgitation and does not mean the baby is choking or vomiting. They may also swallow too much air due to inadequate seal around the teat, made worse by the gaps in the lip and roof of the mouth. They will need to be burped more frequently. The feeding goals are for the baby to take in the right amount of milk, take less than 30 minutes per feed so the baby will not be exhausted and conserve calories for growth, feed every 3 to 4 hourly, avoid swallowing too much air. Here, we will show you how to use the pigeon feeding bottle. The bottle consists of 4 parts: the bottle, the collar ring, the teat with a wide cut and an air vent, and the one-way valve. The teat and collar ring fits standard-sized bottles as well. Fill the bottle with milk. Fit the teat into the collar ring. Place the one-way valve into the teat with the pigeon logo facing inwards. Now you can screw the collar on just tight enough to prevent milk from leaking from the bottleneck. The tighter it is, the slower the milk flow. You can tighten the collar ring if you notice that the flow is too fast for the baby. Squeeze the teat with the bottle upright and then tilt the bottle upside down. Release the teat to allow milk to fill the teat before feeding. Repeat until the teat is filled with milk. This way, the baby will not swallow the air in the teat. Here are some guiding principles to feed your baby. You can loosely swaddle your baby, exposing his torso or arms. Seat your baby in a semi-upright position to prevent milk from flowing through the nose and into the ears. You can use one hand to support the head and neck to make sure the neck is neutral. You may provide cheek and jaw support to facilitate sucking. This helps the baby to feed better. First, wash your hands. Start by stroking his face from the mid-brow, round the cheeks, down to the chin to get him ready for the bottle. Hold the bottle near the collar ring for better control. To further stimulate him, if needed, use the bottle teat to dab the lower lip. It is recommended to have the lip tape on during feeding. Insert the teat into the mouth. Check that the teat is placed centrally on the tongue and directed down and away from the cleft. Keep the teat tilted so that the teat is always filled with milk and not with air. When feeding, the air vent should be under the baby's nose. If the teat collapses when the baby sucks on it, the collar ring is too tight. Loosen the collar ring a little. Check that the lips are pouting outwards to ensure a good seal around the teat. You can place your ring and little finger on the chin to support and reduce the jaw opening so he does not swallow too much air. Listen for a suck, swallow, followed by a breath. After a few days, your baby will move the teat to his most preferred position and develop his own sucking, swallowing, and resting rhythm. Babies with cleft swallow more air. They will need to be burped more often during feeding. You may burp your baby in the usual manner. After milk feeds and before applying new lip tape, you should clean the baby's mouth, nose, and tongue. First, wash and dry your hands. Wet a gauze or clean baby cloth with cool boiled water and wrap it around your little finger. This acts as a mop to remove milk curds from the mouth. Gently use this little finger to mop the upper and lower gums. Change the gauze or use a new side of the gauze to wipe the inside of the cheeks. Do the same and wipe the hard palate and the tongue. To clean the nostrils, wet a cotton bud and wipe around the rim of the nostril, paying attention to the gap in the nostril floor. Check all the hidden corners for milk curds with a torchlight. Lastly, wipe the skin around the mouth. Remember to aim to finish feeding by 30 minutes. If parents have any concerns, they may contact the nurses from our Cleft and Craniofacial Center.